fresh cup of joe, thanks to Timmy Hortons. But while we're here at Gallagher Performance, we're in a good mood. We're going to take you back to the training center because we got a lot of interest from the latest article we posted on the blog regarding shoulders, treatment of shoulder pain, and what is ultimately the most effective form of treatment, and that's exercise. So had great feedback. Ultimately, what we want to piece together, because of some of the feedback and the question, is a video series addressing shoulder function, how we are going to assess it, how can you get a basic understanding of how the shoulder is working, but more importantly, what can you do to address that? Now, understanding the shoulder, there's a lot of complexities there. And with that, we're going to try to keep it cut and dry and helping you understand from a developmental standpoint what may be going on that is hindering performance, or is causing pain, or just restricting range of motion or your sense of mobility or flexibility around the shoulder. For example, if we think about the squat, okay, the squat is a normal human movement. From a developmental standpoint, it's something that we should be able to perform without a problem. Anyone and everyone should be able to squat down and back up, no problem whatsoever. And the inability to do that will demonstrate serious functional pathology. Sometimes, yes, it's structural, but ultimately for the majority of us, there's functional pathology within our movement system, within our muscular system, nervous system, joints, any of those three combined, that is limiting that ability. So same thing is going to be true of the shoulder joint as well. And a nice way to assess that is if we come to the floor, it's the assessment we'll use regularly. And we're going to get on the hands and knees and create a box. Okay, the shoulders are going to be stacked over top of the hands, and our hips are going to be over top of our knees. Now, in this position, we want the middle fingers parallel to one another, and we're just going to settle in. Now, if you get a look at me in this position, most people will tend to be here. Well, what we want to see is the crux of the elbow right here. So this area, which is known as your cubital fossa, we want that facing forward because what that creates is external rotation at the shoulder. Typically, if they're facing one another, which in most people when they load, that's where they are, now their shoulder's in internal rotation, which becomes a dysfunctional or poor loading strategy. Also, at the hand, typically we may see this. The thumb and the thumb pads come up. Rarely do we see the opposite where the hypothenar pad or by the pinky lifts up. So if we are seeing the hands lifting up from the thumb pad, now we start to have an explanation as why there's too much internal rotation within the shoulder, why so many people have problems in trigger points and hypertonicity within their infraspinatus, within their teres, because they are establishing a poor loading strategy. If you simply watch someone's hands when they perform a push-up, oftentimes you will see that as well. So in this position, we can teach proper loading of the hand and how that feeds proper loading of the shoulder, but likewise, proper loading of the shoulder and how that can feed downstream as well. Ultimately, if we want to test the integrity of that support in the shoulder, we can raise one arm forward. When I'm doing this, I do not want any spinal movement or hip movement. I don't want to see a shift to the side. I should be able to lift my arm without any deviation whatsoever. Same thing on the opposite side, lift and then up. Commonly what you see, as I said, is once one arm comes off the ground, we see shift. You see spinal movement, you see hip unleveling, shoulder unleveling. Same thing can be true as if you move the arm to the side. So if this is a position that you have difficulty holding from an external rotation standpoint, from a spinal standpoint, and even from a support, because now once I lift my right arm from the ground, now I'm calling on my left shoulder to stabilize and support my core. Whereas in other environments, my core, my torso is creating the support needed for my shoulder. Another key point to take home from this is once I shift my weight and support, say to my right side, my pec should be off, okay? It shouldn't be contracted. If it's on, if you feel that it's contracted, that's a dysfunctional pattern. Your pec isn't made to stabilize. It's meant to mobilize, it's meant for movement. And if the pec is on, that's a dysfunctional loading strategy. And typically, those that have problematic shoulders, be it pain, limited range of motion, you name it, that's going to be present. If I lift the pec should be loose, it should not be on. So from that standpoint, we have a pretty simple assessment to gain an understanding of what's happening with the shoulder, if there's some underlying dysfunction in their movement system or within their stabilizing or support loading strategies. And in coming videos, what we're going to do is kind of break it down and how to correct some of that. And then from a training standpoint, how can we build stronger shoulders that display better mechanics, better movement, and then ultimately stay healthier in the long run as you get stronger and enhance your overall athleticism performance. So thanks for listening. Stay tuned for more. Like the video, share the video, subscribe to our YouTube channel, stay up to date on what we're doing at Gallagher Performance, and we'll be talking to you guys soon.